Welcome to the AvaSys TeleSitter Solution Introductory course. During this course, we will learn how caregivers like you can help successfully implement the AvaSys program in your facility. In this course, we will describe basic AvaSys components and functions, identify ways the AvaSys program will benefit patients and caregivers, explain the role of bedside caregivers in selecting patients, and communicating with video monitoring staff. By the end of this course, you should be confident and ready to assist in implementing the AvaSys TeleSitter monitor.
Hello, my name is Mary Jane. Today, I would like to introduce you to the AvaSys TeleSitter solution. This program is designed to lower fall rates, make the best use of your nursing resources, and keep patients safe. The AvaSys program allows for multiple patients to be continuously monitored via live video feed by an observer in a central monitoring station from a PC loaded with the AvaSys Smart Client software. The AvaSys monitor unit is placed in the patient's room and provides audio and visual communication between the patient and the observer. AvaSys is available in mobile carts, either wireless or wired, as well as permanent units recessed into the ceiling. All have the same features and components. Observers are trained to anticipate patient behaviors, verbally redirect patients, and alert clinical staff of any potentially high-risk behaviors. The observer uses a headset and microphone to communicate with the patient and uses the hospital's communication system to contact the caregivers on the unit. The AvaSys system meets HIPAA privacy rules. It does not record video or audio. The program also has an electronic privacy curtain that allows in-room clinical staff to ask the observer to stop the live video feed while a bedside procedure or bath is occurring. When the indicator light on the unit goes off and a chime sounds, the privacy mode has been enabled. When the light turns back on and a chime sounds, monitoring has begun. The camera on the unit can pan 360 degrees around the room and zoom in on minute details. The unit also has an automatic infrared illuminator that adjusts the camera to low light conditions. The infrared mode allows the observer to maintain continuous monitoring even when the lights in the patient's room are out. The image will change to black and white, but details are still clearly visible. The audio component allows for two-way communication between the observer and the patient when the immediate communication is needed to redirect a patient for safety or to check in on the patient when needed.
Are you okay? Don't pull at that, please. Lauren, stop doing that, please.
The audio communication is immediate, takes no time, and is very effective at reminding the patient to stay put until help arrives. The monitoring unit also has a stat alert alarm, which sounds in the patient's room. It is activated by the observer when their trained eye sees something they determine to be eminently dangerous. When the alarm sounds, all available staff in the area must respond immediately to the patient's room. Because this alarm is only activated when the observer sees a probable risk to the patient, it is considered a validated alarm and does not contribute to alarm fatigue. The alarm is deactivated by the observer when it is confirmed by video that help has arrived into the patient's room. To help redirect patients with limited or no English proficiency, the AvaSys observer can select and play a series of pre-recorded audio commands in Spanish, Mandarin, and Cantonese, as well as English.
Atención, por favor, no se levante de la cama.
Many other languages are available upon request. Most patients, when in the hospital, are considered at higher risk for injury. The clinical staff will have to select the appropriate patients to receive AvaSys video monitoring based on your hospital's predetermined inclusion criteria. In-room setup is comprised of 4 basic steps. First, if it is a permanent room system, a nurse will give the AvaSys observer the room number so they can activate the camera. If a mobile unit is needed, a nurse requests one from your facility's designated storage location. Next, the unit is placed in the room and plugged in. If it is a wired mobile unit, the Ethernet cable must be plugged in as well. Then, the AvaSys observer confirms that the monitor is on and working properly. This usually takes about 2 minutes. Finally, the nurse provides patient and family education about AvaSys monitoring, and if appropriate, the nurse introduces the observer to the patient. A process will be implemented in your facility to ensure that each change of shift, the new caregiver assignments are quickly communicated to the central monitoring station, so the observer has the needed contact information. This information is recorded directly into the software for quick reference. It is updated each shift with new contact information. When a patient is discharged or no longer requires video monitoring based on nursing assessment, an authorized staff member will notify the observer that monitoring should stop for that patient. Appropriate staff will then clean the monitoring unit and return it to the storage location. You will find that this system requires very little troubleshooting. However, if downtime is required, whether planned or unplanned, the observer's first duty is to notify the clinical staff that monitoring on their patient will be interrupted. AvaSure has a support line staffed 24 hours a day, 365 days a year for any and all user questions. The AvaSys TeleSitter solution gets your in-room sitters back to hands-on patient care, expands the reach of continuous visual monitoring, assists nurses with their daily activities, and helps to improve patient safety at your hospital. Thank you.
Let's start by discussing the different components of the AvaSys TeleSitter system, as well as the monitoring staff role. The AvaSys system has various different units. Here we are showing 2 versions. The mobile unit comes in a wired or wireless version. And beside that is the wall-mounted version. Infrared light for low-light viewing. Pan, tilt, zoom camera. Privacy LED and courtesy chime. When this light is off, privacy mode is active. This allows the patient and anyone in the room to know when the monitor is in privacy mode. When the light is on, it means the monitoring unit is actively monitoring the room. Digital 2-way audio speaker and microphone. Power cord. Digital 2-way audio speaker and microphone. Infrared light for low-light viewing. Privacy LED and courtesy chime. When this light is off, privacy mode is active. This allows the patient and anyone in the room to know when the monitor is in privacy mode. When the light is on, it means the monitoring unit is actively monitoring the room. Pan, tilt, zoom camera. The AvaSys in-room system has the same equipment, but it is permanently installed into the ceilings of patients' rooms. Can you figure out which is which? These AvaSys units allow multiple patients to be monitored and communicated with by the monitoring staff while still providing privacy when needed. The video and audio is only transmitted through the hospital's secured network and is not recorded nor visible to the public. This is so we can protect our patients' privacy and ensure compliance with HIPAA. Monitoring staff are a critical part of the care team. They must learn patients' behaviors to anticipate danger, proactively intervene to prevent adverse events, preserve the dignity of patients, support the bedside caregivers. We will discuss the interaction necessary between RN caregivers and the monitoring staff shortly. But for now, let's talk a little bit about privacy and dignity. To adhere to the HIPAA and CMS conditions of participation, which protect the patient's right to privacy, we make sure patients and family are educated and verbally informed of video monitoring. The system does not record video or audio. The monitoring screen is not visible to visitors or the public. The audio-video feed is protected by being transmitted over the hospital's secured network. To adhere to the American Nurses Association's Code of Ethics, we make sure our privacy screen allows monitor staff to protect the patient's dignity during personal care. AvaSys monitor staff report sensitive information only to caregivers assigned to the patient who have a need to know that information. AvaSys monitor staff only comment about the patient's appearance, behaviors, conditions, or language when necessary. Now let's talk about some of the benefits of using the AvaSys TeleSitter system. Besides peer-reviewed journal articles, there have been over 30 case studies presented as posters or podium presentations at various nursing conferences, demonstrating the effectiveness of AvaSys monitoring in many different healthcare settings. This is a clinically proven nursing intervention to keep patients safe. Now we will turn our attention to the process of admitting or discharging a patient from the AvaSys TeleSitter system. For this course, we will focus on the communication required between the RN caregiver and the monitoring staff to successfully transition a patient who requires monitoring. When an AvaSys monitoring system is put in place, some basic information must be relayed to the monitor technician, such as the patient's name, nickname or preferred name, age, gender, preferred language, preferred announcement voice. In addition, the monitor tech must have the RN caregiver's name and phone number, nurse assistant's name and phone number. The pieces of information are critical to ensure clear communication between the monitor tech and the patient, as well as the monitor tech and the staff caring directly for the patient. Each facility using the AvaSys TeleSitter system will develop specific patient selection criteria for its use. Common reasons an AvaSys monitoring system is used include fall prevention, alcohol or substance withdrawal, delirium, dementia, low-risk suicide, elopement, safety of lines, tubes, and drains, traumatic brain injury, stroke, or any other reason that patients are not able to remember or participate in their plan of care for safety. When unsure of how a patient will react to video monitoring, it is best to do a trial rather than just assuming it will not work. Once the admission information has been collected, the nursing staff is then ready to set up the AvaSys system their facility uses. If your facility uses the AvaSys mobile unit, AMU, keep the following things in mind. When the AMU is obtained, plug it in near the foot end of the room if possible. For best wireless connectivity, keep the AMU at least 2 feet from the television and away from any windows. It is best not to position the AMU behind the patient's head. The AMU must be plugged in at all times. It will take at least 2 minutes to connect to the monitor station. Wait for the monitor staff to talk through the speaker box to do a wireless connectivity check. This is a sample over-the-phone handoff from an RN. It is important to provide the monitoring staff detailed information about the patient and information about where you are calling from and how to reach you. Let's listen to a sample.
Hello, this is a nurse calling to report on a new patient for video monitoring. I'm using AvaSys Unit AMU number 2. This is a female patient who speaks English, and I think she'd be more responsive to a female voice. My main concern for her is that she might fall. She fell twice at home recently, but I also would like to keep an eye on her IV, which is in her left hand, and the oxygen she's getting through a nasal cannula. I'm calling from Ava General Hospital, 4 West. She is in room 438. She told me that she would prefer to be called Dorothy. She's 86 years old. I'm Carol, and my number is 1476. She is in the early stages of dementia, so she doesn't always remember the safety instructions I give her. Some additional information that you can pass on to the next monitor tech is that she isn't critically dependent on the oxygen, so just give me a call if she takes that off. Her daughter told me that Dorothy loves her cat Boots. Her daughter is taking care of Boots while Dorothy is in the hospital.
The monitoring staff can input the patient's information into the AvaSys monitoring software. This allows them to keep a constant watch on all the patients being monitored while the patient's information is readily visible. There is space to the side of the monitoring panes for more detailed information that the monitoring staff will use when they hand off patients to the oncoming monitoring staff. Although the monitoring staff will view multiple patients at once, they only hear and speak to one patient at a time. To hear a sample of the audio.
Boots! Boots! Where are you?
Hello, Mrs. Harper. I'm Dr. Stewart. How are you feeling today?
Okay, Mrs. Riley, let's go over your plan of care for today.
What's going on here? So I went to the editors at the paper, and I happened to work at a...
The 4 interventions monitoring staff can use to keep a patient safe are: 1. The microphone allows the monitoring staff to speak directly to the patient. Verbally redirecting patients is the most frequently used method for keeping patients safe. 2. If the patient does not respond, and it is not an emergency situation, monitoring staff will call the nurse or nursing assistant. 3. Monitoring staff also have the ability to play simple pre-recorded announcements in English and select foreign languages. 4. Monitoring staff are encouraged to use the Stat Alert alarm whenever they believe the patient is at risk for an adverse event. Whenever you hear this alarm, please respond immediately to the patient's room, whether or not that patient has been assigned to your care.
Atención. Por favor, no se levante.
Discharge criteria will also be dictated by facility policy. However, some reasons for discontinuing the AvaSys monitoring system and discharging the patient are: one-to-one sitter is needed due to numerous redirections that are taking the monitoring staff's time and attention away from safe monitoring of other patients. One-to-one sitter is needed due to very frequent Stat Alert alarms. Patient is being discharged from the hospital. The family refuses use to continue. Continuous monitoring is no longer required because the patient's behavior has improved. First, notify the monitoring staff that the patient is being discharged, including the reason why. If your facility uses mobile or wall mount units, do not unplug it until the monitoring staff has electronically discharged the patient from the system. Once the patient is discharged from the AvaSys TeleSitter system, the unit should be appropriately cleaned and returned to the nearest storage area. If your facility has purchased the wireless mobile unit, have a look at the following. Here you can see where it's best to put the AMU in the room for most reliable wireless connection. The green area represents the best position. The yellow area is second best, and the red area should be avoided. Congratulations! You have come to the end of this AvaSys TeleSitter Solution Introductory course. Welcome to the team.